everybody, you're listening to The Scope, Phelps Health Podcast, Episode 3. Today we're discussing COVID-19 updates. Let's get started. Hi everyone, I'm your host, Paige Heitman. The Scope Podcast is produced on a regular basis and can be found by visiting phelpshealth.org. Come back often and feel free to add the podcast to your SoundCloud stream or visit phelpshealth.org. You can also add it to your YouTube channel as well. You can follow Phelps Health on Twitter, Instagram, LinkedIn, and Facebook. All links are in the show notes. Now let's get into the show. Today our guest is Ed Clayton, President and CEO of Phelps Health. Ed, we're talking about a pretty important topic today, COVID-19, so it's pretty important and it's really relevant as well.
Absolutely.
We're going to go ahead and dive in. I know a lot of people already know who you are, so I want to talk about two different things with COVID-19 specifically. We're going to answer some frequently asked questions, and then we're also going to talk about Phelps Health's reopening plan and kind of what that looks like.
Okay.
So how has Phelps Health been conducting testing, and for how long have we been doing that?
Well, really, we began testing in mid-March as part of the ramp up to the COVID crisis, and when activity started in Missouri, we began providing testing in our respiratory screening area using the state lab, and that was at that point for the first 2 weeks it was an interesting process. We would have patients come, they would screen, they would see a provider as part of that screening process. We would, if they seem to have the symptoms that COVID might present with, there's a number of other diseases that might present with that as well.
Course.
The flu, strep, and so those were tested first. If those came back negative, we would contact the state lab department, and they would say yes, you can test, or no, you can test. And so those first 2 weeks we had intermittent testing. We tested the ones the state would allow us to. Actually, since that time, pretty much anybody that has presented themselves with those symptoms, we have given the patient the option to receive the test.
And we also recently did some targeted testing too. Can you talk a little bit about that?
Sure. As part of the state process and through the health department, they selected 8 sites across the entire state. Phelps County was one of those sites, and we utilized our screening setup at Phelps Health. We saw 377 patients, I believe, that came through that screening process. None of the patients that came through our area were identified as positive. They were all negative results. And what I understand is throughout the entire state there was only 12 patients as part of that process that came back as positive, and all those patients were actually symptomatic.
Do you think that means that we're doing a good job of social distancing, or why were those numbers so low?
So I think in our situation, because of where we're located in the country and where we're located in the state, we had the unique ability to really have more time than other places had. So we got the advantage of seeing what was going on in Washington, what was going on in New York. We were hearing about that, seeing the preparations or how they were reacting to it. And we were able to do that quicker here than what was done in other places throughout the country, and really quicker than what was being done in St. Louis or Kansas City or some of the other quote hot spots in Missouri.
So something that you talked about earlier that I want to touch back on is that if somebody is showing signs or symptoms of COVID-19, they can elect to get tested now.
That's correct. Well, the first thing they should do is if they have those signs or symptoms, they need to call their primary care physician. And the primary care physician can instruct them where they need to go for treatment. Outside of that, they can of course show up at our screening facility. They'll receive a medical exam, screening exam by either a physician or a nurse practitioner or a physician assistant. And from that point, if they're showing those signs and symptoms and that provider believes it's appropriate to test for COVID, they'll do that. Because
we've been asked the question a lot, why isn't Phelps Health testing everybody who has signs or symptoms? But we do have the ability to do that. We just have to follow a process now.
That's correct, and part of that goes back to those first 2 weeks when the state was controlling our process. And I don't mean it in a bad way. The state was doing that because they had limited supply.
Of course.
And so they were controlling who we could test and who we couldn't. And so in those first 2 weeks, there were several patients we would have loved to have been able to test, but because of the protocols that were in place, the screening criteria, we weren't able to test them. Really, since early April, we've been pretty much able to test those that come through that screening facility and show those signs and symptoms and pass that screening exam.
And we've gotten some really great feedback from the 10. I know a lot of our community has been really impressed with the ability of our staff at Phelps Health, which is really awesome.
One of the things we've learned is this process is that our employees will really step up to a challenge. Early on, when we started to put up the screening tent, we didn't have to go draft employees to work there. Our employees stepped up and volunteered for it, and it's not an easy job to volunteer for. You're putting yourself in harm's way. We knew early on that this disease transmitted easily, and the employees that worked that facility voluntarily put themselves out there to help their community. We had providers that volunteered to work in that situation, which is different than maybe what their practice normally was.
Mm-hmm.
And so they really stepped up. We've had employees step up and help out in the screening tents, and just all kinds of different roles throughout the organization. So, one of the great things about this, otherwise really
Mm-hmm.
not great situation is that our employees have stepped up and displayed their commitment to Phelps Health and the community and patients in our community, making sure that we are all as healthy as possible. The community has been fantastic in just their donations of PP&E or even food for those that are working at screening tent. It's not a glamorous thing to be out there. Sometimes it's nice and sunny and that's great. Sometimes it's very cold and miserable. Sometimes it's very hot and uncomfortable. And I think our community has recognized the service that our employees are doing for them.
Which is really awesome. So Phelps Health has also been asked to provide very detailed information about patients who have tested positive at Phelps Health. Let's talk a little bit about why we can't and why we won't share that type of information with the public.
So Phelps Health, like most other healthcare providers, are subject to HIPAA laws. And what HIPAA laws are intended to do is to protect patients' confidentiality of their medical information. So just like any other disease process, we do not have the ability to just disclose all kinds of information to the public about a patient's test result, whether it's COVID, whether it's flu, or whether it's some other type of disease.
I don't want people knowing my personal business.
That is protected. So we're not going to release that. Even in this situation, we won't release that. However, because of public health concerns, there is information that's shared back and forth between ourselves and the public health departments that are in the surrounding area. With their roles, they may choose to track the patient where they've been and identify opportunities for connections that have taken place. And so they take that role very seriously, and they'll go about that process to make sure if there's the potential for some type of transmission in the community that they've tracked it that way. So that's outside of our role. Our role is to identify and care for the patient, and the health department does a great job both locally and throughout our region, and so we let them do what they do best.
So to track back what you're saying, it sounds like what people can do is follow the public health Facebook maybe and get that information from them.
100%, and you know this is why we on our Facebook site tag what's going on with the local health departments, because we want to make sure people in our region understand what's going on in terms of potential transmission, or what the numbers are in terms of positives and negatives in the different regions that we serve. So there's reasons why we tag that to our Facebook site, so that the community and the citizens at large can follow what's going on.
It gets really confusing also whenever we're talking about positives, negatives, presumed positives, possible positives, and told to self-quarantine during COVID-19. Can we try to make this a little bit more understandable to the general public? Because it's really confusing even for me, and I work in healthcare.
Yeah, so early on, you mentioned a lot of different things there. Early on, we made the distinction internally about told to self-quarantine versus tested. And so I talked earlier on about the process that the state has. So some people, they would allow us to test, some they wouldn't. Yet we felt like there was enough concern with them, with those particular patients, that we would not want them going out into the community and potentially transmitting COVID. So they were told or asked to self-quarantine. That information was provided to the health department also. And so those patients weren't tested, but they were asked to self-quarantine. So that's one type of one of those indicators.
Okay.
The second one was when we did test a patient, there is a delay in when we receive the information back from the particular lab as to what that result is. So whether it's like with the state it's 1 day, with some of the other entities it's 3 to 7 days. So it can be a lengthy period of time. Well, if this patient is displaying potential signs of COVID, just because we haven't got the result back yet doesn't make it okay that they would be continuing to move around the community and potentially spread that. So those patients would be considered quarantined also, or self-quarantined also. So you have two different categories, the ones that were tested and weren't tested, but both types are told to self-quarantine.
Okay.
And then when you get to the positives and the maybe positives,
Clear as mud.
Yeah, what I would do again is follow what the health department is identification of that. The key is when they're talking about positives or potential positives, it's the degree to which the test really verifies that patient's particular situation. So pay attention when it's a positive or it's a potential positive. The health department would tell you, and I would agree, that you should treat potential positives as positives, and that's what they have done as well. And so I think that's for the community. That's the process they need to go through.
And hopefully that helps clear some frustration and some misunderstanding up for the community as well.
Yeah, certainly we're trying to be as transparent as possible, and the health department is trying to be as transparent as possible as well. So if there's positives, certainly we're letting the health department know that, and the health department is letting the community know that. And so that's I would say, from all the confusion, all the questions about the different categories, follow that line. Follow what the health department is reporting as actual positives or potential positives, and don't try to track innuendo and things like that might be out there.
So now we're going to transition a little bit into our next topic and talk about antibody testing, which is something fairly new that's come out. And antibody testing is kind of helping determine maybe who has had COVID-19, and maybe they didn't realize it because they were asymptomatic, or their symptoms weren't bad enough maybe for them to warrant going through the triage tent or the ER or calling their provider. What can you tell us about antibody testing?
So, first of all, the jury's still out. The theory early on was if you're carrying those antibodies, you've probably been exposed to it, you've probably generated these antibodies, and because you've been exposed to it and you remain asymptomatic, you are somehow immune from acquiring COVID, the bad parts of it. The jury's still kind of out on the truth of that, and so we're trying to understand that better and what that means. But generally speaking, what the antibody testing will tell you is that there's been some type of exposure, and you've built up some type of resistance to it in the not too distant past. That is really relevant as we start to move from these stay-at-home orders where businesses are closed down and really preventing interactions, to where things are, quote, opening up. The more information you can have as part of that process, the better off you're going to be. I would sure like to know whether I have those antibodies or not. It would make me not bulletproof. I'm not immune once I find out, yes, I have them, but it gives me a little bit greater sense of assurance that I don't have quite the same exposure to it that others might.
Can you tell us who's going to be tested first? Because that's probably going to be one of the first questions that people want to know is, can I get in line, and where, and how much money?
Yeah, so again, work through your primary care provider. That's always the best source of truth when you're talking about your own health care, whether it's this issue or any other issue. But we will actually test our employees first. We want to make sure that the folks that are treating potential COVID patients and our workforce is we have as much information for them, so that they understand what their situation is in caring for patients. We'll also open that up to first responders in the community. So, the fire department, the police department, highway patrol, sheriff's office, making sure those first responders that oftentimes have to go into situations and don't fully know what they're always going to go into, so that they're prepared for that. And then after that, we'll start to open it up to the general public. I'll also say that we'll open that up as well to patients that are starting to receive certain services at Phelps Health, to make sure that we understand their situation before that clinical service is provided.
Absolutely. What is Phelps Health doing to protect its staff, patients, and communities as it starts to think about reopening all of its different service lines?
Yeah. So What you will see for us, and it's been in place for a while, for a month or more now at this point, is we will continue to wear our face mask, even though I don't have it on at the moment. I took it off just for this particular video, but we will continue to wear those face masks. That's an important part of preventing transmission. The key stuff like hand washing, I mean, that is hammered into healthcare providers all the time anyway. We will continue to do that to limit transmission. When you come into our organization to receive services, you'll go through a wellness screening. We'll take temperatures, we'll talk to you about your conditions to make sure that you're not exhibiting any of those classic COVID signs that we may need to take some extra precautions in terms of that, of your presence in the facility. We will also work with our clinics to make sure that proper social distancing continues to take place inside our buildings. So, our medical office building has 3 elevator banks, and if you go back 2 months ago, there might be 12 people in the elevator when you get in it. That's not going to be the case going forward. We'll limit the number of people that can be on the elevator. When you go into waiting rooms, we will take measures to make sure that social distancing
We'll be
takes
this
place.
far apart.
We'll be this far apart. And when we will work on scheduling of patients too, to try to keep keep the waiting rooms with as few people as possible. We always try to board patients when they arrive and take them back to their rooms, and we'll continue to really try to do that. Just again, all the things that the social distancing kind of principles that trying to avoid close contact with others where there's the potential for that spread. So we will go out of our way to make sure those things are happening.
Do you think that's going to affect patient care at all?
No, I think actually I'm proud of the way we're doing that, because I think it actually is a positive in terms of the patient care. If there's an impact, it slows down the volume that we're able to see, but the quality of the care will be as good or better than it ever has as we start to reopen up services.
So Ed, something I think that's been on a lot of our minds is healthcare for the future. So has COVID-19 changed the trajectory of healthcare? Are we always going to have screenings whenever we go into hospitals? Can you talk a little bit more to that?
Well, I don't know that we know 100% what the future holds. We will continue to use information that's coming in locally, nationally about transmission of diseases, whether it's COVID or something else, and respond to that as needed. So, early on in this process, as we start to open up services, we're still going to have those wellness screenings. They're not intrusive. We'll still have social distancing in place. It's a little more intrusive than we'd like it sometimes, but it's necessary. We don't know what the future holds, but as things open up and we're 1 month, 2 months down the line, and we're not seeing transmissions, that can tell us that we can back off some of these measures. If we go down the line and we continue to see transmissions or see them ramped up, we may actually have to tighten up things again. So we're really going to have to just, as things move forward, kind of read the environment and respond accordingly.
Something that you had mentioned previously whenever you were on the radio is that you like to only think 2 weeks at a time. So I think that might be important for all of our viewers in our community to start thinking about too. Let's not think years in advance. Let's just try to take it a couple weeks at a time. Yeah,
I'm myself, like a lot of people, are looking forward to things opening up, and I have kids that play baseball, and I love that activity. But we kind of have to see what's going on in our surroundings and respond accordingly. And if we can't decide today that things are opening up and COVID's done and it's behind us, and we move on, and then we start to see numbers spiraling upward again, and not react to that appropriately. So again, I think it's assessing our environment and making sure that we're making the decisions for kind of what we're seeing happening in our community throughout the state and nation.
Well, and we've even talked about this before too. Televisits are something new that we have that are really cool. So even though patients may not be able to come in person, they can still reach out to their provider with televisits, right?
Yeah, just in the last few weeks, we've added additional technology and services that allow us to contact for our physicians and our physician assistants and nurse practitioners to be able to communicate with patients and have those visits that don't require hands-on treatment to be done over a video or telephone. And so that definitely is one of the principles that, talk about social distancing. That's the ultimate social distancing. So we're ramping up more of those services. Again, if that's a service that you think, you need to talk to your physician or talk to your provider, but you're concerned about that interaction, call your physician's office and ask about that potential as a service.
What steps can patients take to protect themselves if they do have an appointment at Phelps Health in the coming weeks?
The first thing I would say is if you have a face mask at home, you should wear that coming in. If you don't, you'll be provided one when you get here. So it's not that we'll leave you completely exposed, but
or send you home.
But that would be my first thing. If you have a face mask at home, I suggest you bring that in. Be aware of your surroundings when you come in. So in other words, there will be people coming and going. Just like if you're out and about anywhere else, we encourage the social distancing. I would encourage people to arrive on time for their appointments. Don't come 45 minutes early or 25 minutes early. If there's no reason for you to be there early, don't be there early, because that just adds to the opportunity for potential interactions that may not be helpful. So arrive on time, but don't arrive very early. And when your appointment's done, I would suggest leaving the facility is appropriate as well.
So you don't suggest showing up early even for the check-in station as well?
Just if you're told at an appointment that be here 10 minutes early, then I would be there 10 minutes early for the appointment. But a lot of times our patients, if it's the once or twice a week or a month or a year that you get in to see your provider, a lot of people are concerned about making sure that they're on time, so they get there really early. I would actually advise against that now.
Awesome. So we're kind of nearing the end of our show, and I want to give you an opportunity to share any final thoughts that you have regarding COVID-19. I know we've talked a lot about reopening. We've answered some frequently asked questions. Are there any final messages or any words of advice that you would like to give to everybody?
Well, not so much about the services that are provided at Phelps Health, but as our community and communities start to open up again, and start to business begin to open up and people get out and about, and it's going to happen. I was at Lowe's this weekend. People are going to be out and about. Keep in mind social distancing. I believe that's why our region, with that advance warning, we were able to put things in place that prevented transmissions. A lot of those principles were exhibited by people in our community early on. I do worry as things open up, people have become fatigued with the social distancing, wearing the face mask, and those kind of things. But I would strongly encourage to continue to do those things. We do want people frequenting local businesses, but keep those social distancing things in mind. Let's do this smart. Let's keep ourselves protected and keep ourselves healthy.
Awesome. So with that, thank you so much for listening to The Scope. I'm your host, Paige Heitman. If you liked our show and would like to know more, visit phelpshealth.org. Thanks so much.